Hi, my name is Pat Beierwaltes. This website will guide your review of my promotion to Associate Professor and tenure application to Minnesota State University Mankato. I am proud to be a nursing professor at Minnesota State Mankato. I had humble beginnings, having been raised on a farm in northwest Minnesota. My parents came from large families, 9 on my mom's side and 13 on my dad's, so needless to say I have cousins on every corner of Minnesota. Neither of my parents finished high school, and they always emphasized how important education was to our family. As a testament to that, all 3 siblings have advanced degrees, including a former FBI agent, now author, a tax lawyer, and a pastor. I rounded out the group by going into healthcare. I often introduce myself as a Minnesotan who lived in exile for many years. During my exile, I took the scenic route into nursing as I was a chemistry major at St. Olaf, worked at the Mayo Clinic in the research lab, and then attended Rush University in Chicago during a time that Luther Chrisman was chair of nursing. Dr. Chrisman was a nurse leader famed for radical and innovative ideas in nursing education and practice. As I reflect on my teaching, I see how his thoughts and teaching have influenced me. After graduation, I took a pediatric ICU position at Rush in Chicago, which I loved, but my goal was to become a nurse practitioner. I completed my master's in nursing at Wayne State University in Detroit and began to work at Children's Hospital Michigan in pediatric neurology. Our division of 2 pediatric neurologists and 1 nurse practitioner grew in just a few years to a group of 12 physicians and 5 nurse practitioners. As a nurse practitioner at Children's Hospital, I was encouraged to participate in research and present at conferences. I was also encouraged to teach our residents, fellows, inpatient nurses, school nurses, outlying hospital, emergency departments, and most importantly, families. I enjoyed the rich diversity that Detroit offered, and that has enhanced my teaching and practice. I became involved at a national and state level with research, education, and advocacy. In 2000, I transitioned to a new position and led a multidisciplinary team that managed over 300 patients with spina bifida and spinal cord injury. While in this position, Wayne State University approached me to become more involved in their pediatric nurse practitioner program. I had precepted students and guest lectured for their program since 1987. I happily accepted, started overseeing clinical students, assisted with didactic, and soon became a course director for the developmental and health assessment course taken by both primary and acute care pediatric nurse practitioner students. I continued to work full-time as a pediatric nurse practitioner while teaching in the evenings. During this time at Children's Hospital, our family also grew. My husband and I have 2 sons and a daughter. All of them felt so at home in Minnesota that they have all graduated from colleges and universities in Minnesota, and 2 of them now call Minnesota home. In the midst of this practice education career, my middle child had a life-changing accident that left him with a spinal cord injury. Having practiced in that field for 8 years, he often said he picked something I knew about. Of course, I remind him that I know about sore throats too, and he could have picked that. He thought it would be a good idea for me to get my doctorate in nursing practice, as I had often talked about, so that I didn't spend so much time worrying about his progress and his going back to college. With the support of my family, I made that commitment to get my doctorate. As I continued to work in our multidisciplinary clinic and making it the best it could be, I applied for and was awarded a $177,000 grant from the Center for Disease Control and Prevention, or the CDC. We became part of the National Spina Bifida Patient Registry. This opened the door to many more collaborative projects across the country. When I announced to the CDC that I was moving to a full-time position in academia, they asked if I could take my projects with me. And so I did. You will see these projects and scholarly activities threaded throughout my application. The application is organized by the 5 criteria: teaching effectiveness, research and scholarly efforts, continuing professional education and study, student development, and service to the university and community. It's difficult to pick out highlights, but I hope that you'll see how I have enjoyed each of the 5 criteria. In Criterion 1, my varied courses and settings, including didactic, clinical, and online, and now creating new experiential learning at Health Commons at Pond for both undergraduate and graduate students, reflect my diverse interests. Check out the student feedback from their experiences at Health Commons at Pond to see how first semester students benefit and tie their experiences into the health promotion objectives of the course. If you prefer to look at quantitative data, look at the 3 tables that I included. Table 1 showing the various educational settings that I've taught in, Table 2 the hardcore numbers from my evaluation, and Table 3 my reflections on course feedback and course modifications based on those reflections. My program of research is divided into 3 distinct areas with subheadings under each area. The 3 areas include impact of spina bifida on patients and families, the impact of hospitalization on families, and the impact of access to school-based healthcare on families and communities. I've included my publications, presentations, and attempts at grant writing. I hope you don't miss the video link to my elevator speech on the work I'm doing with Sandra Eggenberger and David Clisby, a professor in computer information sciences at Minnesota State Mankato. Clearly, the highlight of my continuing professional education was the Iceland Family Nursing Externship. It's rare that a professor gets to be a student for 4 days under the tutelage of such renowned experts. I learned techniques that have enhanced my practice and thus my teaching. As an educator and a nurse practitioner, I think it's imperative that nurse practitioners who teach also practice. The National Organization for Nurse Practitioner Faculty and the American Association of Nursing agree. We need to consider how practice informs teaching and makes our pedagogy more vibrant and relevant. Given the number of letters of recommendation and the number of students who have asked me to pin them at the ceremony prior to graduation, I feel I have fulfilled criterion 4. I truly enjoy the mentoring that goes on long after graduation as they consider graduate schools or as our graduate students consider nurse practitioner positions. In criterion 5, you'll see that I have expanded my work to support my teaching, my scholarship, and my personal interests. This section includes my only successful grant, which is from the Riley Purgatory Bluff Creek Watershed District. In summary, I hope you find this website an easy way to see my growth as professor at Minnesota State Mankato. Remember to click on the hyperlinks, and thank you for your time and attention.